Question 1. Among the following signs and symptoms, which would most likely be present in a client with mitral regurgitation? A. Altered level of consciousness. B. Exertional dyspnea. C. Increased creatine phosphokinase concentration. D. Chest pain. Correct answer, B. Exertional dyspnea. Question 1. Explanation. Mitral regurgitation is defined as an abnormal reversal of blood flow from the left ventricle to the left atrium. Weight gain due to retention of fluids and worsening heart failure causes exertional dyspnea in clients with mitral regurgitation. The patient will usually complain of significant dyspnea at rest, exacerbated in the supine position, as well as cough with clear or pink, frothy sputum. Question 2. Chris with a history of chronic infection of the urinary system complains of urinary frequency and burning sensation. To figure out whether the current problem is of renal origin, the nurse should assess whether the client has discomfort or pain in the A. Urinary meatus. B. Pain in the labium. C. Suprapubic area. D. Right or left costovertebral angle. Correct answer, D. Right or left costovertebral angle. Question 2. Explanation. Discomfort or pain is a problem that originates in the kidney. It is felt at the costovertebral angle on the affected side. Flank or costovertebral angle, CVA. Tenderness is most commonly unilateral over the involved kidney, although bilateral discomfort may be present. Discomfort varies from absent to severe. This finding is usually not subtle and may be elicited with mild or moderately firm palpation. Question 3. Nurse Perry is evaluating the renal function of a male client. After documenting urine volume and characteristics, Nurse Perry assesses which sign says the best indicator of renal function. A. Blood pressure. B. Consciousness. C. Distension of the bladder. D. Pulse rate. Correct answer, A. Blood pressure. Question 3. Explanation. Perfusion can be best estimated by blood pressure, which is an indirect reflection of the adequacy of cardiac output. Over time, uncontrolled high blood pressure can cause arteries around the kidneys to narrow, weaken or harden. These damaged arteries are not able to deliver enough blood to the kidney tissue. Damaged kidney arteries do not filter blood well. Kidneys have small, finger-like nephrons that filter the blood. Question 4. John suddenly experiences a seizure, and Nurse Gina notices that John exhibits uncontrollable jerking movements. Nurse Gina documents that John experienced which type of seizure? A. Tonic seizure. B. Absence seizure. C. Myoclonic seizure. D. Clonic seizure. Correct answer, C. Myoclonic seizure. Question 4. Explanation. Myoclonic seizure is characterized by sudden uncontrollable jerking movements of a single or multiple muscle group. Myoclonus is defined as rapid, brief, jerky, or shock-like movements involving muscle or group of muscles. Among all hyperkinetic movement disorders, myoclonus is considered to be the most rapid and brief. When caused by sudden muscle contraction, it is known as positive myoclonus, while a brief loss of muscular tone results in negative myoclonus as in asterixis. Question 5. Smoking cessation is a critical strategy for the client with Berger's disease. Nurse Jasmine anticipates that the male client will go home with a prescription for which medication? A. Paracetamol. B. Ibuprofen. C. Nitroglycerin. D. Nicotine, Nicotrol. Correct answer, D. Nicotine, Nicotrol. Question 5. Explanation. Nicotine, Nicotrol, is given in controlled and decreasing doses for the management of nicotine withdrawal syndrome. Nicotine replacement therapy, NRT, is for those who want to quit smoking, as abruptly quitting can cause withdrawals and cravings. Nicotine withdrawal occurs after smoking cigarettes discontinued suddenly. Using NRT helps one to reduce the motivation of smoking cigarettes because the body still gets nicotine from another safer method. Question 6. Nurse Lily has been assigned to a client with Raynaud's disease. Nurse Lily realizes that the etiology of the disease is unknown, but it is characterized by A. Episodic vasospastic disorder of capillaries. B. Episodic vasospastic disorder of small veins. C. Episodic vasospastic disorder of the aorta. D. Episodic vasospastic disorder of the small arteries. Question 7. Nurse Jamie should explain to a male client with diabetes that self-monitoring of blood glucose is preferred to urine glucose testing because A. More accurate. B. Can be done by the client. C. It is easy to perform. D. It is not influenced by drugs. Correct answer, A. More accurate. Question 7. Explanation. Urine testing provides an indirect measure that may be influenced by kidney function, while blood glucose testing is a more direct and accurate measure. Accurate measurement of blood glucose is superior to the capillary blood glucose test. However, this is dependent on the laboratory meeting established industry standards. Question 8. Jessie weighed 210 pounds on admission to the hospital. After 2 days of diuretic therapy, Jessie weighs 205.5 pounds. The nurse could estimate the amount of fluid Jessie has lost. A. 0.3 liters. B. 1.5 liters. C. 2.0 liters. D. 3.5 liters. Correct answer, C. 2.0 liters. Question 8. Explanation. 1 liter of fluid approximately weighs 2.2 pounds. 4.5 pound weight loss equals to approximately 2 liters. Diuresis is necessary for a variety of non-edematous and edematous conditions, which require clearing out excess water when the body abnormally sequesters fluid in third space in the form of edema. Question 9. Nurse Donna is aware that the shift of body fluids associated with intravenous administration of albumin occurs in the process of A. Osmosis. B. Diffusion. C. Active transport. D. Filtration. Correct answer, A. Osmosis. Question 9. Explanation. Osmosis is the movement of fluid from an area of lesser solute concentration to an area of greater solute concentration. In physiology, osmosis, Greek for push, is the net movement of water across a semi-permeable membrane. Across this membrane, water will tend to move from an area of high concentration to an area of low concentration. It is important to emphasize that ideal osmosis requires only the movement of pure water across the membrane without any movement of solute particles across the semi-permeable membrane. Question 10. Myrna, a 52-year-old client with a fractured left tibia, has a long leg cast and she is using crutches to ambulate. Nurse Joy assesses for which sign and symptom that indicates complication associated with crutch walking. A. Left leg discomfort. B. Weak biceps brachii. C. Triceps muscle spasm. D. Forearm weakness. Correct answer, D. Forearm weakness. Question 10. Explanation. Forearm muscle weakness is a probable sign of radial nerve injury caused by crutch pressure on the axillae. Crutch palsy is observable in axilla crutch users who rest their weight on the shoulder rest. The pressure on the brachial plexus can result in palsy to the radial and ulnar nerves. Extra padding on the shoulder rest can aid in preventing crutch palsy. Question 11. Which of the following statements should the nurse teach the neutropenic client and his family to avoid? A. Performing oral hygiene after every meal. B. Using suppositories or enemas. C. Performing perineal hygiene after each bowel movement. D. Using a filter mask. Correct answer, B. Using suppositories or enemas. Question 11. Explanation. Neutropenic clients are at risk for infection, especially bacterial infection of the gastrointestinal and respiratory tract. An incorrectly administered enema can damage tissue in your rectum/colon, cause bowel perforation and, if the device is not sterile, infections. Question 12. A female client is experiencing a painful and rigid abdomen and is diagnosed with a perforated peptic ulcer. A surgery has been scheduled and a nasogastric tube is inserted. The nurse should place the client before surgery in A. Sims position. B. Supine position. C. Semi-Fowler's position. D. Dorsal recumbent position. Correct answer, C. Semi-Fowler's position. Question 12. Explanation. Semi-Fowler's position will localize the spilled stomach contents in the lower part of the abdominal cavity. Initiation of fluid resuscitation should start as soon as the diagnosis is made. Insertion of a nasogastric tube to decompress the stomach and a Foley catheter to monitor urine output are essential steps. Question 13. Which nursing intervention ensures adequate ventilating exchange after surgery? A. Remove the airway only when the client is fully conscious. B. Assess for hypoventilation by auscultating the lungs. C. Position client laterally with the neck extended. D. Maintain humidified oxygen via nasal cannula. Correct answer, C. Position client laterally with the neck extended. Question 13. Explanation. Positioning the client laterally with the neck extended does not obstruct the airway so that drainage of secretions and oxygen and carbon dioxide exchange can occur. This position promotes oxygenation via maximum chest expansion and is implemented during events of respiratory distress. Do not let the client slide down, this causes the abdomen to compress the diaphragm, which could cause respiratory change. Question 14. George, who has undergone thoracic surgery, has a chest tube connected to a water-sealed drainage system attached to suction. Presence of excessive bubbling is identified in the water-sealed chamber. The nurse should A. Strip the chest tube catheter. B. Check the system for air leaks. C. Recognize the system is functioning correctly. D. Decrease the amount of suction pressure. Correct answer, B. Check the system for air leaks. Question 14 Explanation. Excessive bubbling indicates an air leak which must be eliminated to permit lung expansion. Know the location of air leak, patient or system centered, by clamping thoracic catheter just distal to exit from the chest. If bubbling stops when the catheter is clamped at the insertion site, leak is patient-centered, at insertion site or within the patient. Question 15. A client who has been diagnosed with hypertension is being taught to restrict intake of sodium. The nurse would know that the teachings are effective if the client states that A. I can eat celery sticks and carrots. B. I can eat broiled scallops. C. I can eat shredded wheat cereal. D. I can eat spaghetti on rye bread. Correct answer, C. I can eat shredded wheat cereal. Question 15 Explanation. Wheat cereal has a low sodium content. Sodium controls fluid balance in the body and maintains blood volume and blood pressure. Eating too much sodium may raise blood pressure and cause fluid retention, which could lead to swelling of the legs and feet or other health issues. Question 16. A male client with a history of cirrhosis and alcoholism is admitted with severe dyspnea resulting from ascites. The nurse should be aware that the ascites is most likely the result of increased A. Pressure in the portal vein. B. Production of serum albumin. C. Secretion of bile salts. D. Interstitial osmotic pressure. Correct answer, A. Pressure in the portal vein. Question 16 Explanation. Enlarged cirrhotic liver impinges the portal system causing increased hydrostatic pressure resulting in ascites. Portal pressure increases above a critical threshold and circulating nitric oxide levels increase, leading to vasodilation. As the state of vasodilatation becomes worse, the plasma levels of vasoconstrictor sodium retentive hormones elevate, renal function declines, and acidic fluid forms, resulting in hepatic decompensation. Question 17. A newly admitted client diagnosed with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. What does the nurse assess first after the procedure? A. Vital signs. B. Incision site. C. Airway. D. Level of consciousness. Correct answer, C. Airway. Question 17 Explanation. Assessing for an open airway is the priority. The procedure involves the neck. The anesthesia may have affected the swallowing reflex or the inflammation may have closed in on the airway leading to ineffective air exchange. When the numbness wears off, the throat may feel scratchy for several days. After the test, the cough reflex will return in 1 to 2 hours. Then the client may eat and drink normally. Question 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? A. Systolic blood pressure less than 90 mm Hg. B. Pupils unequally dilated. C. Respiratory rate of 4 breaths per minute. D. Pulse rate less than 60 beats per minute. Question 19. Nurse Lucy is planning to give preoperative teaching to a client who will be undergoing rhinoplasty. Which of the following should be included? A. Results of the surgery will be immediately noticeable postoperatively. B. Normal saline nose drops will need to be administered preoperatively. C. After surgery, nasal packing will be in place 8 to 10 days. D. Aspirin-containing medications should not be taken 14 days before surgery. Correct answer, A. Systolic blood pressure less than 90 mm Hg. Question 18 Explanation. Typical signs and symptoms of hypovolemic shock include systolic blood pressure of less than 90 mm Hg. The first changes in vital signs seen in hypovolemic shock include an increase in diastolic blood pressure with narrowed pulse pressure. As volume status continues to decrease, systolic blood pressure drops. As a result, oxygen delivery to vital organs is unable to meet oxygen demand. Correct answer, D. Aspirin-containing medications should not be taken 14 days before surgery. Question 19 Explanation. Aspirin-containing medications should not be taken 14 days before surgery to decrease the risk of bleeding. Impaired coagulation may cause postoperative complications. Patients should be asked about a history of excessive bruising or bleeding, consumption of drugs, supplements, or vitamins that alter coagulation cascade or history of thrombotic events in the past. Any drug, vitamins, or supplement that impairs coagulation might have to be suspended preoperatively. Question 20. Paul is admitted to the hospital due to metabolic acidosis caused by diabetic ketoacidosis, DKA. The nurse prepares which of the following medications as an initial treatment for this problem? A. Regular insulin. B. Potassium. C. Sodium bicarbonate. D. Calcium gluconate. Correct answer, A. Regular insulin. Question 20. Explanation. Metabolic acidosis is anaerobic metabolism caused by lack of ability of the body to use circulating glucose. Administration of insulin corrects this problem. The discovery of insulin, along with the antibiotics, has led to a drastic decrease in mortality with DKA, down to 1%. Intravenous insulin by continuous infusion is the standard of care. Previous treatment protocols have recommended the administration of an initial bolus of 0.1 units per kilogram, followed by the infusion of 0.1 units per kilogram per hour. Question 21. Dr. Marquez tells a client that an increased intake of foods that are rich in vitamin E and beta-carotene are important for healthier skin. The nurse teaches the client that excellent food sources of both of these substances are A. Fish and fruit jam. B. Oranges and grapefruit. C. Carrots and potatoes. D. Spinach and mangoes. Correct answer, D. Spinach and mangoes. Question 21. Explanation. Beta-carotene and vitamin E are antioxidants which help to inhibit oxidation. Vitamin E is found in the following foods: wheat germ, corn, nuts, seeds, olives, spinach, asparagus and other green leafy vegetables. Food sources of beta-carotene include dark green vegetables, carrots, mangoes and tomatoes. Question 22. A client has gastroesophageal reflux disease, GERD. The nurse should teach the client that after every meal, the client should A. Rest in a sitting position. B. Take a short walk. C. Drink plenty of water. D. Lie down at least 30 minutes. Correct answer, A. Rest in a sitting position. Question 22. Explanation. Gravity speeds up digestion and prevents reflux of stomach contents into the esophagus. Instruct to remain in an upright position at least 2 hours after meals, avoiding eating 3 hours before bedtime. Helps control reflux and causes less irritation from reflux action into the esophagus. Question 23. After gastroscopy, an adaptation that indicates major complication would be A. Nausea and vomiting. B. Abdominal distension. C. Increased GI motility. D. Difficulty in swallowing. Correct answer, B. Abdominal distension. Question 23. Explanation. Abdominal distension may be associated with pain, may indicate perforation, a complication that could lead to peritonitis. Bowel perforation occurs in less than 0.3% of cases, and infection is rarely reported. Complications typically are identified in the first 24 hours after the procedure. Perforation is identified due to fever, tachycardia, abdominal pain or discomfort. Question 24. A client who has undergone a cholecystectomy asks the nurse whether there are any dietary restrictions that must be followed. Nurse Hillary would recognize that the dietary teaching was well understood when the client tells a family member that A. Most people need to eat a high-protein diet for 12 months after surgery. B. I should not eat those foods that upset me before the surgery. C. I should avoid fatty foods as long as I live. D. Most people can tolerate regular diet after this type of surgery. Correct answer, D. Most people can tolerate regular diet after this type of surgery. Question 24. Explanation. It may take 4 to 6 months to eat anything, but most people can eat anything they want. Start with clear liquids after the surgery to prevent nausea, vomiting, and constipation, soup, jello, juices, popsicles, and carbonated beverages, then advance to a regular low-fat diet. Eat smaller meals more often instead of fewer larger meals. Question 25. Nurse Rachel teaches a client who has been recently diagnosed with hepatitis A about untoward signs and symptoms related to hepatitis that may develop. The one that should be reported immediately to the physician is A. Restlessness. B. Yellow urine. C. Nausea. D. Clay-colored stools. Correct answer, D. Clay-colored stools. Question 25. Explanation. Clay-colored stools are indicative of hepatic obstruction. Acute HAV infection is typically a self-limited illness characterized by nausea, vomiting, right upper quadrant abdominal discomfort, malaise, anorexia, myalgia, fatigue, and fever. Patients may develop dark urine and pale stools within a week, followed by jaundice, icteric, yellow-tinted, sclera, and pruritus. Question 26. Which of the following anti-tuberculosis drugs can damage the 8th cranial nerve? A. Isoniazid. B. Para-aminosalicylic acid. C. Ethambutol hydrochloride, myambutal. D. Streptomycin. Correct answer, D. Streptomycin. Question 26. Explanation. Streptomycin is an aminoglycoside and damage to the 8th cranial nerve, ototoxicity, is a common side effect of aminoglycosides. Ototoxicity and vestibular impairment are often thought to be the hallmark of streptomycin toxicity. In extreme cases, deafness may occur due to ototoxicity, thus caution must be exercised when combining streptomycin with other potentially ototoxic drugs. Vestibular impairment usually manifests during the course of treatment and is typically permanent. Question 27. The client asks Nurse Annie the causes of peptic ulcer. Nurse Annie responds that recent research indicates that peptic ulcers are the result of which of the following? A. Genetic defect in gastric mucosa. B. Stress. C. Diet high in fat. D. Helicobacter pylori infection. Correct answer, D. Helicobacter pylori infection. Question 27. Explanation. Most peptic ulcers are caused by Helicobacter pylori, which is a gram-negative bacterium. H. pylorus is a gram-negative bacillus that is found within the gastric epithelial cells. This bacterium is responsible for 90% of duodenal ulcers and 70% to 90% of gastric ulcers. H. pylori infection is more prevalent among those with lower socioeconomic status and is commonly acquired during childhood. The organism has a wide spectrum of virulence factors, allowing it to adhere to and inflame the gastric mucosa. This results in hypochlorhydria or achlorhydria, leading to gastric ulceration. Question 28. Ryan has undergone a subtotal gastrectomy. The nurse should expect that nasogastric tube drainage will be what color for about 12 to 24 hours after surgery? A. Bile green. B. Bright red. C. Cloudy white. D. Dark brown. Correct answer, D. Dark brown. Question 28. Explanation. 12 to 24 hours after subtotal gastrectomy, gastric drainage is normally brown, which indicates digested food. Assess color, amount, and odor of gastric drainage, noting any changes in these parameters or the presence of clots or bright bleeding. Initial drainage is bright red. It becomes dark, then clear or greenish yellow over the first 2 to 3 days. A change in the color, amount, or odor may indicate a complication such as hemorrhage, intestinal obstruction, or infection. Question 29. Nurse Joan is assigned to come for a client who has just undergone eye surgery. Nurse Joan plans to teach the client activities that are permitted during the postoperative period. Which of the following is best recommended for the client? A. Watching circus. B. Bending over. C. Watching TV. D. Lifting objects. Correct answer, C. Watching TV. Question 29. Explanation. Watching TV is permissible because the eye does not need to move rapidly with this activity, and it does not increase intraocular pressure. Once the patient gets home, it is recommended that they rest their eyes and nap. Several hours post-surgery, most people are able to watch some television or look at a computer screen for a short period of time. Because cataract surgery is only performed on one eye at a time, the patient may notice an imbalance in the vision until the second eye is operated on, usually 1 to 4 weeks later. Question 30. A client suffered from a lower leg injury and seeks treatment in the emergency room. There is a prominent deformity to the lower aspect of the leg, and the injured leg appears shorter than the other leg. The affected leg is painful, swollen and beginning to become ecchymotic. The nurse interprets that the client is experiencing A. Fracture. B. Strain. C. Sprain. D. Contusion. Correct answer, A. Fracture. Question 30. Explanation. Common signs and symptoms of fracture include pain, deformity, shortening of the extremity, crepitus and swelling. These injuries are associated with symptoms of pain, deformity, swelling, and a wound that may be bleeding. It should be noted that the wound may not lie directly over the fracture site. The movement and neurovascular status of all involved limbs should be assessed to ascertain whether or not there is a possible nerve or vascular injury associated with the fracture. Question 31. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? A. Pulling the auricle backward and upward. B. Warming the solution to room temperature. C. Pacing the tip of the dropper on the edge of the ear canal. D. Placing the client in a side-lying position. Correct answer, C. Placing the tip of the dropper on the edge of the ear canal. Question 31 Explanation. The dropper should not touch any object or any part of the client's ear. Don't allow the dropper tip to touch the ear, fingers, or any other surface. It could pick up bacteria or other germs that can lead to an ear infection. Question 32. Nurse B should instruct the male client with an ileostomy to report immediately which of the following symptoms? A. Absence of drainage from the ileostomy for 6 or more hours. B. Passage of liquid stool in the stoma. C. Occasional presence of undigested food. D. A temperature of 37.6 degrees Celsius. Correct answer, A. Absence of drainage from the ileostomy for 6 or more hours. Question 32 Explanation. Sudden decrease in drainage or onset of severe abdominal pain should be reported immediately to the physician because it could mean that obstruction has been developed. Sometimes the ileostomy does not function for short periods of time after surgery. This is not usually a problem, but if the stoma is not active for more than 6 hours and the patient experiences cramps or nausea, he may have an obstruction. Question 33. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? A. Intestinal obstruction. B. Peritonitis. C. Bowel ischemia. D. Deficient fluid volume. Correct answer, B. Peritonitis. Question 33 Explanation. Complications of acute appendicitis or peritonitis, perforation and abscess development. Diffuse peritonitis and sepsis can also develop, which may progress to significant morbidity and possible death. Postoperative abscesses, hematomas, and wound complications are all complications that can be seen after appendectomies. If the wound does get infected, one may grow bacteroides. Recurrent appendicitis can occur if too much of the appendiceal stump is left after an appendectomy. Question 34. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? A. Myocardial infarction. B. Cirrhosis. C. Peptic ulcer. D. Pneumonia. Correct answer, D. Pneumonia. Question 34 Explanation. A client with acute pancreatitis is prone to complications associated with the respiratory system. The relationship between Mycoplasma pneumoniae infection and acute pancreatitis has been debated in the literature. In 1973, Mart et al. Reported 4 adult cases of acute pancreatitis following pneumonia due to MP. In 3 of the patients, the pancreatitis occurred in the 3rd week after the onset of cough, by which time the respiratory tract symptoms had almost disappeared. Question 35. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? A. Watery stool. B. Yellow sclera. C. Tarry stool. D. Shortness of breath. Correct answer, B. Yellow sclera. Question 35 Explanation. Liver inflammation and obstruction block the normal flow of bile. Excess bilirubin turns the skin and sclera yellow and the urine dark and frothy. After 3 to 10 days, the urine darkens, followed by jaundice. Systemic symptoms often regress, and patients feel better despite worsening jaundice. The liver is usually enlarged and tender, but the edge of the liver remains soft and smooth. Mild splenomegaly occurs in 15 to 20% of patients. Jaundice usually peaks within 1 to 2 weeks. Question 36. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of A. Diuretics. B. Antihypertensive. C. Steroids. D. Anticonvulsants. Correct answer, C. Steroids. Question 36 Explanation. Glucocorticoids, steroids, are used for their anti-inflammatory action, which decreases the development of edema. Corticosteroids produce their effect through multiple pathways. In general, they produce anti-inflammatory and immunosuppressive effects, protein and carbohydrate metabolic effects, water and electrolyte effects, central nervous system effects, and blood cell effects. Question 37. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should A. Increase the flow of normal saline. B. Assess the pain further. C. Notify the blood bank. D. Obtain vital signs. Correct answer: A. Increase the flow of normal saline. Question 37 Explanation: The blood must be stopped at once, and then normal saline should be infused to keep the line patent and maintain blood volume. Treatment is to stop the transfusion, leave the fourth in place, intravenous fluids with normal saline, keeping urine output greater than 100 milliliters/hour. Diuretics may also be needed and cardiorespiratory support is appropriate. A hemolytic workup should also be performed, which includes sending the donor blood and tubing as well as post-transfusion labs, see below for a list, from the recipient to the blood bank. Question 38. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? A. A history of high-risk sexual behaviors. B. Positive ELISA and Western blot tests. C. Identification of an associated opportunistic infection. D. Evidence of extreme weight loss and high fever. Correct answer: B. Positive ELISA and Western blot tests. Question 38 Explanation: These tests confirm the presence of HIV antibodies that occur in response to the presence of the human immunodeficiency virus, HIV. When there is a possibility of acute or early HIV infection, the most sensitive screening immunoassay available, ideally, a combination antigen/antibody immunoassay, in addition to an HIV virologic, viral load, test is performed. RT-PCR-based viral load test is favored. A positive HIV virologic test generally indicates HIV infection. Question 39. Nurse Maureen is aware that a client who has been diagnosed with chronic renal failure recognizes an adequate amount of high biological value protein when the food the client selected from the menu was: A. Raw carrots. B. Apple juice. C. Whole wheat bread. D. Cottage cheese. Correct answer: D. Cottage cheese. Question 39 Explanation: 1 cup of cottage cheese contains approximately 225 calories, 27 grams of protein, 9 grams of fat, 30 milligrams cholesterol, and 6 grams of carbohydrate. Proteins of high biological value contain optimal levels of amino acids essential for life. In general, proteins from animal sources have a higher biological value than proteins from plant sources. Animal sources of protein are meat, poultry, fish, eggs, milk, cheese and yogurt, and they provide high biological value proteins. Question 40. Kenneth, who was diagnosed with uremic syndrome, has the potential to develop complications. Which among the following complications should the nurse anticipates? A. Flapping hand tremors. B. An elevated hematocrit level. C. Hypotension. D. Hypokalemia. Correct answer: A. Flapping hand tremors. Question 40 Explanation: Elevation of uremic waste products causes irritation of the nerves, resulting in flapping hand tremors. The classic description has been in hepatic diseases, but other causes can commonly cause asterixis, including azotemia and respiratory disease. Asterixis is a disorder of motor control characterized by an inability to actively maintain a position and consequent irregular myoclonic lapses of posture affecting various parts of the body independently. Question 41. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse most relevant assessment would be: A. Flank pain radiating in the groin. B. Distension of the lower abdomen. C. Perineal edema. D. Urethral discharge. Correct answer: B. Distension of the lower abdomen. Question 41 Explanation: This indicates that the bladder is distended with urine, therefore palpable. In the elective setting, the examination should include abdominal examination, looking for a palpable bladder/lung pain, and examination of external genitalia, meatal stenosis or phimosis. Benign prostatic hyperplasia, BPH, refers to the non-malignant growth or hyperplasia of prostate tissue and is a common cause of lower urinary tract symptoms in men. Question 42. A client has undergone a penile implant. After 24 hours of surgery, the client's scrotum was edematous and painful. The nurse should: A. Assist the client with sitz bath. B. Apply warm soaks in the scrotum. C. Elevate the scrotum using a soft support. D. Prepare for a possible incision and drainage. Correct answer: C. Elevate the scrotum using a soft support. Question 42 Explanation: Elevation increases lymphatic drainage, reducing edema and pain. The penis should then be placed upward on the lower abdomen, to limit any downward curvature of this penis postoperatively. Scrotal support or tight mesh underwear may be used after the sterile dressing is removed. Question 43. Nurse Hazel receives emergency laboratory results for a client with chest pain and immediately informs the physician. An increased myoglobin level suggests which of the following? A. Liver disease. B. Myocardial damage. C. Hypertension. D. Cancer. Correct answer, B. Myocardial damage. Question 43 Explanation. Detection of myoglobin is a diagnostic tool to determine whether myocardial damage has occurred. Myoglobin, an oxygen-carrying protein found in cardiac muscle and striated skeletal muscle, presents an attractive alternative to CPK and LDH in the emergency department setting for identification of acute myocardial infarction. Myoglobin levels may be elevated in the serum within 1 hour after myocardial cell death, with peak levels reached within 4 to 6 hours. Question 44. Nurse Maureen would expect a client with mitral stenosis would demonstrate symptoms associated with congestion in the A. Right atrium. B. Superior vena cava. C. Aorta. D. Pulmonary. Correct answer, D. Pulmonary. Question 44 Explanation. When mitral stenosis is present, the left atrium has difficulty emptying its contents into the left ventricle because there is no valve to prevent backward flow into the pulmonary vein. The pulmonary circulation is under pressure. Mitral valve areas less than 2 square centimeters causes an impediment to the blood flow from the left atrium into the left ventricle. This creates a pressure gradient across the mitral valve. As the gradient across the mitral valve increases, the left ventricle requires the atrial kick to fill with blood. Question 45. A client has been diagnosed with hypertension. The nurse priority nursing diagnosis would be A. Ineffective health maintenance. B. Impaired skin integrity. C. Deficient fluid volume. D. Pain. Correct answer, A. Ineffective health maintenance. Question 45 Explanation. Managing hypertension is the priority for the client with hypertension. Clients with hypertension frequently do not experience pain, deficient volume, or impaired skin integrity. It is the asymptomatic nature of hypertension that makes it so difficult to treat. Monitor and record BP. Measure both arms and thighs 3 times, 3 to 5 minutes apart while the patient is at rest, then sitting, then standing for initial evaluation. Use correct cuff size and accurate technique. Question 46. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin, including A. High blood pressure. B. Stomach cramps. C. Headache. D. Shortness of breath. Correct answer, C. Headache. Question 46 Explanation. Because of its widespread vasodilating effects, nitroglycerin often produces side effects such as headache, hypotension, and dizziness. Headaches can be severe, throbbing, and persistent and may occur immediately after use. Vasodilation and venous pooling can increase the amount of blood in the cranial space, resulting in increased intracranial pressures. This can cause persistent, throbbing headaches, along with confusion, fever, vertigo, nausea, vomiting, and visual disturbances. Question 47. The following are lipid abnormalities. Which of the following is a risk factor for the development of atherosclerosis and PVD? A. High levels of low-density lipid, LDL, cholesterol. B. High levels of high-density lipid, HDL, cholesterol. C. Low-concentration triglycerides. D. Low levels of LDL cholesterol. Correct answer, A. High levels of low-density lipid, LDL, cholesterol. Question 47 Explanation. An increase in LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down into the liver but is deposited into the wall of the blood vessels. As the LDL particles leave the blood and enter the arterial intima, they accumulate by being trapped by proteoglycans and are modified. While the modifications of LDL are not elucidated, oxidative modification generating oxidized LDL appears to be an attractive candidate. Question 48. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? A. Potential wound infection. B. Potential ineffective coping. C. Potential electrolyte imbalance. D. Potential alteration in renal perfusion. Correct answer, D. Potential alteration in renal perfusion. Question 48 Explanation. There is a potential alteration in renal perfusion manifested by decreased urine output. The altered renal perfusion may be related to renal artery embolism, prolonged hypotension, or prolonged aortic cross-clamping during the surgery. Intervention or surgical treatment risks versus benefits of repair in patients at increased risk for open surgery should be considered, and no intervention may be appropriate in some cases. Patients should be well informed regarding their options, risks of repair, and potential postoperative complications. Question 49. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? A. Dairy products. B. Vegetables. C. Grains. D. Broccoli. Correct answer, A. Dairy products. Question 49. Explanation. Good sources of vitamin B12 are dairy products and meats. Among animal products, those from ruminants are particularly rich in vitamin B12, which is naturally synthesized by the ruminal microflora and transferred to milk. Dairy products retain, in general, a major part of the vitamin B12 naturally present in milk. Some processing conditions may even add to the basal level by production of vitamin B12 from propionic bacteria in Swiss-type cheeses. Question 50. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following physiologic functions? A. Bowel function. B. Peripheral sensation. C. Bleeding tendencies. D. Intake and output. Correct answer, C. Bleeding tendencies. Question 50. Explanation. Aplastic anemia decreases the bone marrow production of RBCs, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. Aplastic anemia refers to the syndrome of chronic primary hematopoietic failure from injury leading to diminished or absent hematopoietic precursors in the bone marrow and attendant pancytopenia. Question 51. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge final assessment would be A. Signed consent. B. Vital signs. C. Name band. D. Empty bladder. Correct answer, B. Vital signs. Question 51. Explanation. An elective procedure is scheduled in advance so that all preparations can be completed ahead of time. The vital signs are the final check that must be completed before the client leaves the room so that continuity of care and assessment is provided for. Question 52. What is the peak age range for acquiring acute lymphocytic leukemia, ALL? A. 4 to 12 years. B. 20 to 30 years. C. 40 to 50 years. D. 60 to 70 years. Correct answer, A. 4 to 12 years. Question 52. Explanation. The peak incidence of acute lymphocytic leukemia, ALL, is 4 years of age. It is uncommon after 15 years of age. It is diagnosed in about 4,000 people in the United States each year, with the majority being under the age of 18. It is the most common malignancy of childhood. The peak age of diagnosis is between 2 and 10 years of age. Question 53. Marie with acute lymphocytic leukemia suffers from nausea and headache. These clinical manifestations may indicate all of the following except A. Effects of radiation. B. Chemotherapy side effects. C. Meningeal irritation. D. Gastric distension. Correct answer, D. Gastric distension. Question 53. Explanation. Acute lymphocytic leukemia, ALL, does not cause gastric distension. It does invade the central nervous system, and clients experience headaches and vomiting from meningeal irritation. The primary care provider and nurse practitioner may be responsible for follow-up after treatment and report back to the interprofessional team. These patients need close monitoring as they are prone to infections, coagulation dyscrasias, and relapse. Question 54. A client has been diagnosed with disseminated intravascular coagulation, DIC. Which of the following is contraindicated with the client? A. Administering heparin. B. Administering Coumadin. C. Treating the underlying cause. D. Replacing depleted blood products. Correct answer, B. Administering Coumadin. Question 54. Explanation. Disseminated intravascular coagulation, DIC, has not been found to respond to oral anticoagulants such as Coumadin. Warfarin is contraindicated in patients with hemorrhagic tendencies, for example, active GI ulceration, patients bleeding from the GI, respiratory, or GU tract, a cerebral aneurysm, central nervous system, CNS, hemorrhage, dissecting aortic aneurysm, spinal puncture, and other diagnostic or therapeutic procedures with the potential for significant bleeding. Question 55. Which of the following findings is the best indication that fluid replacement for the client with hypovolemic shock is adequate? A. Urine output greater than 30 milliliters per hour. B. Respiratory rate of 21 breaths/minute. C. Diastolic blood pressure greater than 90 mm of mercury. D. Systolic blood pressure greater than 110 mm of mercury. Correct answer, A. Urine output greater than 30 milliliters per hour. Question 55 Explanation. Urine output provides the most sensitive indication of the client's response to therapy for hypovolemic shock. Urine output should be consistently greater than 30 to 35 milliliters per hour. Renal losses of salt and fluid can lead to hypovolemic shock. The kidneys usually excrete sodium and water in a manner that matches intake. Diuretic therapy and osmotic diuresis from hyperglycemia can lead to excessive renal sodium and volume loss. In addition, there are several tubular and interstitial diseases beyond the scope of this article that cause severe salt-wasting nephropathy. Question 56. Which of the following signs and symptoms would Nurse Maureen include in her teaching plan as an early manifestation of laryngeal cancer? A. Stomatitis. B. Airway obstruction. C. Hoarseness. D. Dysphagia. Correct answer, C. Hoarseness. Question 56 Explanation. Early warning signs of laryngeal cancer can vary depending on tumor location. Hoarseness lasting 2 weeks should be evaluated because it is one of the most common warning signs. Patients are typically male with a history of current or past tobacco smoking. Hoarseness is often an early presenting symptom of glottic cancers due to vocal cord immobility or fixation, with pain with swallowing and referred ear pain indicating advanced disease. Question 57. A non-immunized child appears at the clinic with a visible rash. Which of the following observations indicates the child may have rubeola, measles? A. Small blue-white spots are visible on the oral mucosa. B. The rash begins on the trunk and spreads outward. C. There is a low-grade fever. D. The lesions have a teardrop on a rose petal appearance. Correct answer, A. Small blue-white spots are visible on the oral mucosa. Question 57 Explanation. Koplik's spots are small blue-white spots visible on the oral mucosa and are characteristic of measles infection. Most cases show the characteristic Koplik spots of the disease, located in the buccal mucosa at the height of the second molar, and appear 2 to 3 days before the rash and disappear on the third day. Question 58. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? A. Scarlet fever is caused by infection with group A Streptococcus bacteria. B. Strawberry tongue is a characteristic sign. C. Petechiae occur on the soft palate. D. The pharynx is red and swollen. Correct answer, C. Petechiae occur on the soft palate. Question 58 Explanation. Petechiae on the soft palate are characteristic of rubella infection. Postnatal infection with rubella can be asymptomatic in approximately 25% to 50% of the patients, especially in young children. The incubation period ranges from 14 to 21 days and is followed by a prodromal illness characterized by low-grade fever, malaise, anorexia, headaches, sore throat, and adenopathy. Question 59. A child weighing 30 kilograms arrives at the clinic with diffuse itching as the result of an allergic reaction to an insect bite. Diphenhydramine, Benadryl 25 mg 3 times a day is prescribed. The correct pediatric dose is 5 mg/kg/day. Which of the following best describes the prescribed drug dose? A. It is the correct dose. B. The dose is too low. C. The dose is too high. D. The dose should be increased or decreased, depending on the symptoms. Correct answer, B. The dose is too low. Question 59 Explanation. This child weighs 30 kilograms, and the pediatric dose of diphenhydramine is 5 mg/kg/day. 5 by 30 equals 150 per day. Therefore, the correct dose is 150 mg/day. Diphenhydramine, which is available as an over-the-counter medication, is a first-generation antihistamine that is used in a variety of conditions to treat and prevent dystonias, insomnia, pruritus, urticaria, vertigo, and motion sickness. Question 60. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statements about the undescended testis is the most accurate? A. Normally, the testes are descended by birth. B. The infant will likely require surgical intervention. C. The infant probably has only one testis. D. Normally, the testes descend by 1 year of age. Correct answer, D. Normally, The testes descend by 1 year of age. Question 60 Explanation. Normally, the testes descend by 1 year of age. In young infants, it is common for the testes to retract into the inguinal canal when the environment is cold or the cremasteric reflex is stimulated. About 3% of full-term and 30% of premature male infants are born with one or both testicles undescended. Approximately 80% of cryptorchid testes descend by the 3rd month of life. This makes the true incidence around 1%. Question 61. Mrs. Chua, a 78-year-old client, is admitted with a diagnosis of mild chronic heart failure. The nurse expects to hear when listening to client's lungs indicative of chronic heart failure would be A. Stridor, B. Crackles, C. Wheezes, D. Friction rubs. Correct answer, B. Crackles. Question 61 Explanation. Left-sided heart failure causes fluid accumulation in the capillary network of the lung. Fluid eventually enters alveolar spaces and causes crackling sounds at the end of inspiration. Pulmonary edema may cause crackling sounds in the lungs. People with congestive heart failure, CHF, often have pulmonary edema. CHF occurs when the heart cannot pump blood effectively. This results in a backup of blood, which increases blood pressure and causes fluid to collect in the air sacs in the lungs. Question 62. Patrick, who is hospitalized following a myocardial infarction, asks the nurse why he is taking morphine. The nurse explains that morphine A. decreases anxiety and restlessness, B. prevents shock and relieves pain, C. dilates coronary blood vessels, D. helps prevent fibrillation of the heart. Correct answer, B. prevents shock and relieves pain. Question 62 Explanation. Morphine is a central nervous system depressant used to relieve the pain associated with myocardial infarction. It also decreases apprehension and prevents cardiogenic shock. FDA-approved usage of morphine sulfate includes moderate to severe pain that may be acute or chronic. Most commonly used in pain management, morphine provides major relief to patients afflicted with pain. Question 63. Which of the following should the nurse teach the client about the signs of digitalis toxicity? A. Increased appetite, B. elevated blood pressure, C. skin rash over the chest and back, D. visual disturbances such as seeing yellow spots. Correct answer, D. visual disturbances such as seeing yellow spots. Question 63 Explanation. Seeing yellow spots and colored vision are common symptoms of digitalis toxicity. Of note, visual changes, especially changes involving colors such as seeing a yellow hue, are better known and specifically seen in digitalis toxicity. Other visual problems include photophobia, photopsia, and diminished visual acuity. Question 64. Nurse Tricia teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help A. retard rapid drug absorption, B. excrete excessive fluids accumulated at night, C. prevents sleep disturbances during night, D. prevention of electrolyte imbalance. Correct answer, C. prevents sleep disturbances during night. Question 64 Explanation. When diuretics are taken in the morning, the client will void frequently during daytime and will not need to void frequently at night. Normally, when an individual receives furosemide either orally or intravenously, it increases sodium excretion in urine. In a patient with extracellular volume expansion who has never had exposure to furosemide, the first dose of the drug causes significant sodium excretion and diuresis within the first 3 to 6 hours. Question 65. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? A. Enhance comfort, B. increase cardiac output, C. improve respiratory status, D. peripheral edema decreased. Correct answer, B. increase cardiac output. Question 65 Explanation. The primary goal of therapy for the client with pulmonary edema or heart failure is increasing cardiac output. Pulmonary edema is an acute medical emergency requiring immediate intervention. Preload reduction decreases pulmonary capillary hydrostatic pressure and reduces fluid transudation into the pulmonary interstitium and alveoli. Afterload reduction increases cardiac output and improves renal perfusion, which allows for diuresis in the patient with fluid overload. Question 66. Nurse Linda is caring for a client with head injury and monitoring the client with decerebrate posturing. Which of the following is a characteristic of this type of posturing? A. upper extremity flexion with lower extremity flexion, B. upper extremity flexion with lower extremity extension, C. extension of the extremities after a stimulus, D. flexion of the extremities after stimulus. Correct answer, See extension of the extremities after a stimulus. Question 66 Explanation. Decerebrate posturing is the extension of the extremities after a stimulus which may occur with upper brainstem injury. Decerebrate posturing is described as adduction and internal rotation of the shoulder, extension at the elbows with pronation of the forearm, and flexion of the fingers. Question 67. A female client is taking Cascara Sagrada. Nurse Betty informs the client that the following may be experienced as side effects of this medication. A. GI bleeding. B. Peptic ulcer disease. C. Abdominal cramps. D. Partial bowel obstruction. Correct answer, C. Abdominal cramps. Question 67 Explanation. The most frequent side effects of Cascara Sagrada, laxative, is abdominal cramps and nausea. Cascara Sagrada is possibly safe for most adults when taken for less than 1 week. Side effects include stomach discomfort and cramps. Question 68. Dr. Marquez orders a continuous intravenous nitroglycerin infusion for the client suffering from myocardial infarction. Which of the following is the most essential nursing action? A. Monitoring urine output frequently. B. Monitoring blood pressure every 4 hours. C. Obtaining serum potassium levels daily. D. Obtaining infusion pump for the medication. Correct answer, D. Obtaining infusion pump for the medication. Question 68 Explanation. Administration of intravenous nitroglycerin infusion requires a pump for accurate control of medication. There are intravenous, 4, routes of administration for nitroglycerin used most commonly in emergency rooms and intensive care units, ICU. It is administered as a 5% dextrose in water drip and is indicated when sublingual nitroglycerin has failed to provide symptomatic relief or if rapid and continued relief of symptoms is necessary. When administered, its effect requires tight monitoring. Question 69. During the second day of hospitalization of the client after a myocardial infarction, which of the following is an expected outcome? A. Able to perform self-care activities without pain. B. Severe chest pain. C. Can recognize the risk factors of myocardial infarction. D. Can participate in cardiac rehabilitation walking program. Correct answer, A. Able to perform self-care activities without pain. Question 69 Explanation. By the second day of hospitalization after suffering a myocardial infarction, clients are able to perform care without chest pain. Instruct the patient to report pain immediately. Provide a quiet environment, calm activities, and comfort measures. Approach the patient calmly and confidently. Decreases external stimuli, which may aggravate anxiety and cardiac strain, limit coping abilities, and adjustment to the current situation. Question 70. A 68-year-old client is diagnosed with a right-sided brain attack and is admitted to the hospital. In caring for this client, the nurse should plan to A. Application of elastic stockings to prevent flaccid by muscle. B. Use hand roll and extend the left upper extremity on a pillow to prevent contractions. C. Use a bed cradle to prevent dorsiflexion of feet. D. Do passive range of motion exercise. Correct answer, B. Use hand roll and extend the left upper extremity on a pillow to prevent contractions. Question 70 Explanation. The left side of the body will be affected in a right-sided brain attack. Begin active or passive ROM to all extremities, including splinted, on admission. Encourage exercises such as quadriceps/glutes exercise, squeezing rubber ball, extension of fingers and legs/feet. Minimizes muscle atrophy, promotes circulation, helps prevent contractures. Reduces risk of hypercalciuria and osteoporosis if the underlying problem is hemorrhage. Question 71. Nurse Liza is assigned to care for a client who has returned to the nursing unit after left nephrectomy. Nurse Liza's highest priority would be A. Hourly urine output. B. Temperature. C. Able to turn side to side. D. Able to sips clear liquid. Correct answer, A. Hourly urine output. Question 71 Explanation. After nephrectomy, it is necessary to measure urine output hourly. This is done to assess the effectiveness of the remaining kidney, also to detect renal failure early. Immediately after surgery, the healthcare team will carefully watch the client's blood pressure, electrolytes and fluid balance. These body functions are controlled in part by the kidneys. The client will most likely have a urinary catheter, tube to drain urine, in the bladder for a short time during the recovery. Question 72. A 64-year-old male client with a long history of cardiovascular problems including hypertension and angina is to be scheduled for cardiac catheterization. During pre-cardiac catheterization teaching, Nurse Cherry should inform the client that the primary purpose of the procedure is A. To determine the existence of CHD. B. To visualize the disease process in the coronary arteries. C. To obtain the heart chamber's pressure. D. To measure oxygen content of different heart chambers. Correct answer, B. To visualize the disease process in the coronary arteries. Question 72 Explanation. The lumen of the arteries can be assessed by cardiac catheterization. Angina is usually caused by narrowing of the coronary arteries. Left heart catheterization has a diagnostic as well as therapeutic role. Although it is used for cardiac hemodynamics and assessment of valvular lesions, its main diagnostic role is the assessment of coronary artery disease. In the contemporary era, left heart catheterization, especially selective coronary angiogram, is considered the gold standard test for coronary artery disease diagnosis. Question 73. During the first several hours after a cardiac catheterization, it would be most essential for Nurse Cherry to A. Elevate the client's bed at 45 degrees. B. Instruct the client to cough and deep breathe every 2 hours. C. Frequently monitor the client's apical pulse and blood pressure. D. Monitor client's temperature every hour. Correct answer, C. Frequently monitor the client's apical pulse and blood pressure. Question 73 Explanation. Blood pressure is monitored to detect hypotension, which may indicate shock or hemorrhage. The apical pulse is taken to detect arrhythmias related to cardiac irritability. During the procedure, a nurse is assigned to monitor vital signs. After the procedure, the nurse is also responsible for ensuring that the access site is not bleeding and the distal extremity pulses are intact. Question 74. Kate, who has undergone mitral valve replacement, suddenly experiences continuous bleeding from the surgical incision during the postoperative period. Which of the following pharmaceutical agents should Nurse Isa prepare to administer to Kate? A. Protamine sulfate. B. Quinidine sulfate. C. Vitamin C. D. Coumadin. Correct answer, A. Protamine sulfate. Question 74 Explanation. Protamine sulfate is used to prevent continuous bleeding in a client who has undergone open heart surgery. Protamine is a medication used to reverse and neutralize the anticoagulant effects of heparin. Protamine is the specific antagonist that neutralizes heparin-induced anticoagulation. Protamine is a strongly alkaline, nearly 2/3 of the amino acid composition is arginine, polycationic low molecular weight protein found in salmon sperm that is also currently available in a recombinant form. Question 75. In reducing the risk of endocarditis, good dental care is an important measure. To promote good dental care in clients with endocarditis, in a teaching plan should include proper use of A. Dental floss. B. Electric toothbrush. C. Manual toothbrush. D. Irrigation device. Correct answer, C. Manual toothbrush. Question 75 Explanation. The use of an electric toothbrush, irrigation device or dental floss may cause bleeding of gums, allowing bacteria to enter and increasing the risk of endocarditis. Maintaining good oral hygiene and infection control can decrease the incidence of endocarditis in the moderate risk group of patients and can eliminate the necessity of antibiotic prophylaxis of endocarditis.